Anna, we are covering breaking Olympic news this morning. Lindsey Vonn says she will compete at the Winter Games despite the fact that she ruptured the ACL in her left knee.
Our 9 News medical expert joins us now with how this will impact her performance. Dr. Coley, good morning.
Good morning.
So talk about her injury first. She said she completely ruptured her ACL, but she also says she has bone bruising and meniscal damage.
Yeah, so the ACL is the anterior cruciate ligament. And think about it as a little band of tissue that stabilizes the knee, and it stabilizes it from moving forward. It stabilizes it from rotating and twisting in an abnormal fashion, and it offers a column of stability. So really for Lindsey, when she's downhill skiing, this offers the brakes, so to speak, on her skiing. And then the meniscal tear, the meniscus is sort of the shock absorber of the knee. It's a band of cartilage that prevents the shin bone and the thigh bone from rubbing together, so that absorbs the shock as well. So when your ACL is compromised, the meniscus takes over and tries to really help stabilize the knee. When you have an injury to both of those structures, it can be extremely high risk for downhill skiing, especially for accidents to happen because you've lost your brakes and you've lost your shock absorbers.
So we know she tested out her knee earlier this morning, but not at the high speed it's going to take to win one of these races at the Olympics. How much of a difference does that make?
So that certainly helps to test it, but really they say with these types of injuries, Drew, she should, not be skiing at these types of speeds for 9 to 12 months.
Oh, wow.
Now, the brace that she puts on her knee can help offer a bit of stability, especially for that ACL tear. And because it's a complete tear, that's a bigger deal than a partial tear. But it's still not going to protect the meniscus. And so not only is she risking potentially crashing, not only is she risking having instability and having a bad injury, but she's even risking long-term arthritis to occur in an accelerated fashion on her knee.
Yeah, it shows you she's just putting it all on the line and really risking everything because she wants to be part of this Olympics. She said that she's not going to take any painkillers. She says she's not in pain right now. What do you think about that?
This is a tough one because certainly painkillers, while she's skiing, can impair her ability to respond quickly. They could be against the Olympic rules. But when you're having a high degree of pain, you tend to, treat your joint a little bit differently. So I think not taking painkillers could impact her performance during the event, certainly with such a big injury that she has, a complete tear as well as a meniscal tear. I think that this is a tough situation because I think she wants to be on her best. She wants to be able to respond, and which is why she's declining the painkillers, but it could affect her ability to perform as well as she can.
Dr. Coley, when we hear the phrase ruptured ACL, we typically know that means months of rehab, right, for the athlete or the individual involved. Here we are watching someone rupture their ACL and then compete at the highest level in the world within a few days. I mean, do you have any examples of this in your past where you can say, well, this reminds me of A, B, or C?
Drew, I'll say that if she had one or the other injury, I could potentially see her competing. Personally, I'm a little surprised that the Olympic doctors have cleared her to compete because having both injuries together makes her extremely high risk. And generally for athletes, when they have a complete ACL rupture, we don't do conservative management. We usually do surgical repair to help accelerate the healing, and that can shorten the timeline of healing. But even with surgical repair, you're talking about 2 to 3 months before you can get back for an athlete to that level of performance. So the fact that she's doing this days after this type of an injury certainly reflects her dedication. But I have to say, as a physician, I'm concerned, and I really hope and pray that she does okay, because again, she's taken away her brakes and she's taken away her shock absorbers, and that brace is only going to offer her minimal support.
Yeah, that's what I was going to ask you about. They're going to wrap it, they're going to put a brace on it. But sometimes that can give you, false, reassurance that your knee's better or that it's okay, and how much is that actually going to help her when she's competing?
So I think, Corey, it will help stabilize the knee. So the ACL is a knee stabilizer. And if you stabilize it externally with the brace and the ACE bandage, then you can kind of create that fixed column. And for skiing, as you know, you really need to have sort of a continuous column between your hips and your ankles, because that's what you're using to control your turns and to make sharp edges and such. So I think it will offer some support. But again, it's not going to protect her meniscus, first of all. And with the speeds that she's going, that type of external support just may not be enough. I would have felt better about a brace and wrapping if she only had a partial tear of her ACL, not complete.
Again, Dr. Coley joining us this morning to talk about one of our breaking news stories this morning. Lindsey Vonn says she will compete in the Olympics. In fact, she's expected to compete in 5 days on Sunday in the downhill, just days after rupturing her ACL. We appreciate you, Dr. Coley, joining us here last minute to talk about that injury.
We know all eyes will be on Lindsey Vonn this weekend, too. Dr. Coley, thank you. Douglas.